You said it takes a little space for a media event.
All right, we ready? Okay. Well, my name is Stacey Wood. I'm the Health and Human Services Public Information Officer here in Buncombe County. So thanks for joining us today. Today we are providing an update on COVID-19 vaccination operations as we begin the first day of administering Phase 1B Group 1 vaccines in our community. Today we have Stacey Saunders, Buncombe County Public Health Director, and Fletcher Tove, Buncombe County Public Health Preparedness Director, here with us to provide an update on vaccine operations and to answer your questions. We also have Tiffany Hanacho here with us today. She is the Director of Buncombe County Justice Services, and she's going to be telling us a bit about her experience receiving the COVID-19 vaccination as a frontline healthcare worker. So we'll start off with, I'm happy to spell names for you now or after the event. Tiffany's name is Tiffany, Tiffany. Her last name Iheanacho. Stacey Saunders' name is spelled Staciesaunders. And Fletcher Tove, Fletchertove. So we'll go ahead and get started with an overview from Stacey. We'll hear from Tiffany, and then we'll open it up to questions.
Good morning. Thank you so much for being with us today. I am Stacey Turpin Saunders, Public Health Director for Buncombe County. Today is an exciting day as we begin to immunize our 75 years and older population in Phase 1B Group 1 of the vaccine rollout. This comes at a time when cases continue to be the highest we have experienced since the pandemic start. The current surge in cases post the holidays brings with it an increased percent positivity in our community. Both the increased cases and rise in percent positivity indicate that we have widespread and increased viral spread. During this same time of significant spread, there is hope amongst us. You might remember that we received our first shipment of vaccine just before Christmas holiday and have received weekly shipments since that time. We began vaccinating Phase 1A healthcare workers and medical first responders within 24 hours of receiving our very first shipment. This is a testament to the dedication of our public health staff, our partners in emergency management, and the many other partners committed to ending this pandemic. We have provided over 1,433 vaccines with our first couple of shipments. This week, we have completely filled our schedule despite the challenges we faced with the phone system. This means that we scheduled about 1,200 appointments for vaccine. While that is not nearly enough to cover the current populations included in 1B Group 1 and those remaining in Phase 1A, it is progress each week toward protecting our community. In addition to the appointment line, we have also provided online scheduling for those who meet the criteria for current phase and are interested in receiving vaccine. Due to vaccine supply limitations, appointments are likely to fill up quickly, just as they did this week. But as we receive notification from the state of our expected weekly shipments, we will open new appointments to help meet the need. Currently, hospitals and health departments are the primary location where vaccine is received. We hope in the coming days and weeks that more of our community providers will be successfully launched as enrolled providers by North Carolina DHHS. As vaccine supply increases, this will provide more opportunity and locations for vaccine. Vaccine rollout of this magnitude is unprecedented and is not without its bumps in the road, the biggest hurdle being limited vaccine supply. We ask our community to be patient and understanding as we continue to vaccinate our community with such small amounts of vaccine. We will not have sufficient or ample supplies for some time, but we remain committed to fighting COVID-19. As vaccine is rolled out, it is important for our community to remain committed to fighting COVID-19 as well. Please remember to limit your interactions, stay at home when possible, practice the 3 W's even with your family and friends, and get your vaccine when it's your turn in your phase. Many thanks for your time today. We can turn our trends around and protect our community, one Buncombe working together. And now I'd like to welcome Tiffany to the podium.
Good morning, everyone. My name is Tiffany Hanacho, and in addition to being the Director of Justice Services at Buncombe County, I also serve as a licensed therapist in our local emergency room. I received my first dose of the Pfizer vaccine on December 20th, and today I'll receive my second dose of the Pfizer vaccine through my employer at the hospital. I've had 0 side effects. I took the vaccine because it's safe and effective, like any other vaccine. I want to make sure in August my daughter can experience kindergartner with the rest of her students her age, and I want to return to traveling and being around family and friends. I also know that this virus disproportionately impacts people of color, and it's important for us all to take ownership of our community's health. We know that vaccines are limited now, but we are excited about the public's response, and we are ramping up our operations. And I can't wait for my 79-year-old grandmother to get the vaccine. Thank you.
All right, so now we have Fletch and Stacey and Tiffany here. So if you'll just go ahead and ask your questions, and we'll go ahead and get started.
Do we know how many vaccines have been given out, like the number of people, the age ranges, and stuff like that?
So locally,
Yes.
do you want me to repeat it? So locally, we have given out 1,433 vaccines thus far, and that mostly that's with our first 2 shipments. Today, what we're vaccinating with would be our 3rd shipment that we received. I do not have a breakdown for you of what that looks like demographically.
Typically, when someone comes in, how long does it take them to register up here and go through the process and walk out and be vaccinated?
I'll let Fletch handle that.
So the question is, typically, what's the time from someone arrives till they receive the vaccine? So far, we've been averaging about 8 to 9 minutes from the time of entry to the time of vaccination. We have seen today with the older age group a slight delay in that time. But so typically, once you arrive at our vaccine site, in about 9 minutes, you'll be receiving your vaccine. There is, however, I want to point out, post-vaccine, there's a 15 or 30-minute waiting period for observation just for safety, depending on if you have certain medical history. So that you have to add that in time. So about 9-10 minutes to vaccination plus a 15-minute observation time.
kind of response have you had? I know that the vaccination appointment slots have filled up, so have you been overloaded? And I guess your message to the public, we've gotten lots of phone calls at the station, so I just want to get a sense of what it's like behind the scenes and then what message you would like to help that.
Thanks for that. So the question was, what sort of feedback are we getting with limited vaccine supply and therefore limited scheduling of appointments? And so I can tell you that we had such an overwhelming demand, particularly as we entered into phase 1B group 1 with our 75 years and older, that we did have issues with our phone system and had to pivot. So in addition to the phone system, opening up the online portal and to allow folks to be able to make an appointment. Now, even with those two options, there's only a limited number of appointments, and it is far less than what the population we're trying to reach. And so we continue to revise that phone message, revise that message on our website, make sure we work with partners like you, that folks understand that as we get more information about what our shipments are going to look like in the future, we can open more appointments. So again, asking folks to be patient and understanding that we recognize that there is not enough vaccine right now for everyone, but we are committed to continuing to open up those appointments as soon as we get our notification of our next shipment so that we can do that.
Do you have any idea when hospitals or other providers will start helping this effort?
So hospitals receive vaccine just like health departments do right now and are committed to continuing to reach their phase 1A population. Other community providers are in the process of getting enrolled. And that involves them getting enrolled in CVMS, which is the state vaccine management system. And we are hopeful that as the end of January and early February come, that we will hear of more community health centers, FQHCs, urgent cares, primary care providers being launched as enrolled providers, because that does open up a lot more doors. Literally, it opens up a lot more doors. And it's still to be determined whether or not those providers will receive vaccine immediately from the state. But there are also mechanisms that allow hospitals and health departments, if they have more than what they can feasibly vaccinate, to transfer vaccine to those community partners, like our FQHCs and our urgent cares. We are not there yet. We are not receiving enough vaccine to do that yet. We hope that we get in that position where we'll be able to partner with more of our community providers so that folks have more locations, more opportunity, and may even be able to get it in their medical home, which is really important.
Has Mission given you any idea when they may have gone through 1A and they can start handing over? Will they hand it over or will they start vaccinating?
I do not have that timeline, and Mission would have to answer that for them.
On Tuesday, you all said that you didn't have much information about how the process was going with CVS and Walgreens as far as vaccination at the long-term care facilities. Is there any update about where that process is now?
So the question was for the federal program to vaccinate long-term care facilities through CVS and Walgreens. Unfortunately, I do not have much more information than what we had on Tuesday, which is that many skilled nursing facilities did sign up to be in the federal program. I do not know the progress toward that. We anecdotally hear from some of our long-term care facilities that either they have started or they have not. In addition to that, local health departments are still responsible for the long-term care facilities that did not enroll in the federal program. So in addition to the fixed sites that you're seeing, we also have a team that goes out to those long-term care facilities that are not enrolled in the federal program to make sure that that vulnerable population in phase 1A is also vaccinated.
To the point of long-term care facilities, we've heard reports that there have been residents, or rather staff who work there, saying they don't want to get vaccinated. Is that a trend we've seen in Buncombe County at all?
So the question was, are we seeing a trend with long-term care facilities not wanting to be vaccinated? I don't know that we're seeing a trend. When we reach out to the long-term care facilities that are on our list, so not on the federal program, some are very willing and ready, and it's all of their staff and all of their residents. Others, it varies. And so just like the general population, we expect that we'll see some hesitancy in that group as well. We encourage them to rethink about getting the vaccine, particularly for the staff, as we know that long-term care facilities have been very hard hit during COVID, and it's an extremely vulnerable population.
Buncombe County has the highest vaccine exemption rate in the state. Are you getting any questions from the feedback? Are you hearing anything in the community about misconceptions, and are there things that you'd like to dispel for the public about the COVID vaccine?
So the question was about misinformation, particularly with our high non-vaccinating population. And so in general, I'll just say with phase 1A and 1B group 1, who we've been most focused on, the demand has been there, that we're not hearing that from those groups in any significant way. That particularly as we entered into phase 1B group 1, which are 75 years and older, that group was ready. They are ready to get this vaccine, and we are ready to give it to them and wish that we had more vaccine to give. So that population understands the risk that they are at high risk for severe illness if they were to get COVID-19, and understand the benefits of protecting themselves through a COVID vaccine. Now, in general, we know that there's some hesitancy just nationally, statewide as well, and there's been lots of communication to help dispel myths, put out facts, even on our website, our social media in the state at North Carolina Department of Health and Human Services has done a really good job of putting out lots of information to different groups and widely on their website to help folks understand that the vaccine is safe, it's effective, and it can protect us. And as we get more and more of it, the more that our communities embrace it, the more we are getting closer to being done with the pandemic.
In terms of receiving vaccine, are you talking about receiving vaccine from the state or at the federal level? Like, where's the hang-up kind of happening?
So so locals receive vaccine through an allocation from North Carolina Department of Health and Human Services, who receives their their notification allocation from the federal government. So the federal government is pushing it out to states. States decide how it will be divided out amongst their counties or however they're doing that. And then the locals receive that vaccine at their hospital or health department at this point.
Any idea about how much vaccine is received at a state level in comparison to how much has been received here locally? Like, is there, I guess what I'm asking is there a hang-up at the state where they're receiving vaccine but having an issue getting it out to our local facilities, our local counties, or is it more slow, I guess, at the federal level?
So the question is about state distribution and what that looks like statewide versus locally. I do not have a full statewide number. I do know that the state works to whatever allocation that the federal government states to them that they will be getting as a state. They divide that up amongst the counties based on hospital and health departments, population, and the need within the designated phases. And then that's how we receive our vaccine allotment.
We've had a couple reports or questions from readers asking about extra doses at the end of the day, either maybe appointment no-shows or if there are extra doses left in the vaccine vials that might not be able to be stored until the next day. Is that something you all are either prepared for or experiencing, and what's the policy, if so, about people trying to get those extra doses?
Thanks for that question. The question was about extra doses at the end of the day. So we try to be very careful not to thaw out more than what we're going to need for the day, not to pull up more than what we're going to need for the event. In the event that we have a few extra doses left at the end of the day, we have some of our staff at the vaccination sites who have not received their first dose, so they would be able to receive their first dose at that time. Some of our first responders who may not have gotten it in the first round or may not be designated in the medical first responders but are helping out at the vaccine clinics would all be folks that we would want to use those first on. We never want to waste a vaccine, so we try really hard not to minimize any type of extra doses at the end of the day. We have a pharmacist who works with us who is back there inventorying as we go throughout the day and is responsible with one of our nurses to pull that up and make sure that we're using it effectively and efficiently. So thanks for that.
We've also received reports that tourists have been able to get vaccine from Asheville and Buncombe County. Is there any merit to that at all?
I'm sorry, what, tourists?
Yeah.
Okay, so the question was about tourists receiving vaccine. I do not have a printout as to everyone who's getting the vaccine or what their location or address is. We're committed to getting folks vaccine. And so if you live and work in Buncombe County, we want you to get a vaccine when it's your turn. And so I don't have any more information.
Health Secretary Mandy Cohen last week was asked about, can you go cross-county to another county to get your vaccine, and she said yes. So your thoughts about, do you want people to do that? I mean, how would that, are you hearing anything about that, or your message to the public who may be in another county and come into Buncombe County, or vice versa?
So the question was about folks being able to cross county lines to be able to get vaccine. The commitment is fighting the pandemic. We understand that folks may work in one county and live in another and vice versa. So it is totally understandable that folks might go over county lines because of having work there, learning there, whatever their reason is. And so we want people to get vaccinated and support the secretary.
Have any local elected officials received vaccines, and do you know where they might fall in the process?
Have any elected officials refused vaccine?
Or received vaccine?
Received vaccine. And are you all sending that? Okay. Yes. So we have had one locally elected official receive their vaccine today because they are in the over 75 population. Commissioner Whitesides was with us earlier today. I believe you all are going to be getting some footage of that, and was really excited to be here. Really appreciated that it was in a nice, good location, and that it was easily accessible, and the process was very easy from, as Fletch said, from registration to vaccine to observation, that it didn't take much time. So we have had one, and appears to have had a good experience.
When appointments are scheduled, is it that those appointments are scheduled in one sitting when you're registering for an appointment here in Buncombe County?
First and second dose, is that
Yeah.
what you're talking? So scheduling process for first and second dose. Do you want to come there? You want me to? First and second. So we do first dose first, and then since the phases are very limited right now, so phase 1A was healthcare workers critical to COVID care, treatment, assessment, evaluation. So that was a group that we could go right into their practices or to their employers, be able to get all of their information up front and be able to send them information. So for second dose, we will be doing a very similar process since we were able to do that with them. Going forward, our phone system will still be in place, our online portal will still be in place, and we hope to be transitioning that online portal to one that is connected to our electronic medical record system, so that scheduling of first and second doses from here on out would be even more efficient than what it is now. So at the time of vaccine, first dose, folks get their vaccine, they get a reminder of when their second dose is going to be, and should receive notification within email or some other form to schedule their second.
Any more questions? All right. Well, just as a reminder, we would ask the community to visit buncombeready.org and sign up for the COVID-19 newsletter and for BC Alerts so that they are able to get information sent directly to their phone and email when we do have updates. So if there are no more questions, thank you all for being here and for being such great media partners. We couldn't do it without you. Also, so what we're not letting any media into the area, but you can get shots from